Welcome back. Dr. Timothy Weeks here, and I need to talk to you about cholesterol. So many people are concerned about eating fat and heart disease, and rightfully so. Heart disease is one of the top causes of death in this country. In the body, cholesterol is sort of like the fire department in your town. It responds to damage. And so, if you were up in space and you were looking down, and every single time you saw a fire going on, you saw men with little red hats running around that fire. Well, eventually you might start thinking, those men with little red hats are causing all these fires. When in fact, we know the truth is they're trying to put them out. Cholesterol is no different. You know, this idea that consuming cholesterol causes heart disease has been going on for over 100 years since a Russian researcher named Nikolai Anichukov first proposed it. Nikolai found that when he fed cholesterol to rabbits and studied them, when they died, he did autopsies and saw that they had heart disease. And so from this one poorly run study, he proposed to the world that eating cholesterol caused heart disease, and it started 100 years ago. They tried to repeat Nikolai's study multiple times, feeding rats pure cholesterol and doing autopsies and trying to see if in fact it created heart disease. And it never did. They could never repeat the experiment. One of the largest cholesterol studies of its kind, known as the Framingham Heart Study, began in 1948 and continues to this day. And it studied the residents of Framingham, Massachusetts, which is where it got its name. And it followed them through generations. They're currently on the third generation of studying these people. And this study has clearly demonstrated that total cholesterol is not a good indicator of heart disease. This was again proved by a series of studies known as the Jupiter studies, which were published in the New England Journal of Medicine in 2009. This randomized, double-blind, placebo-controlled study investigated 17,802 healthy people with no history of heart disease, and they put them on a preventative cholesterol medication. The results of this 1.9-year-long study showed that one heart attack was prevented for every 244 people that took statins. Think about that, one heart attack. That's a 0.0004% rate. Meanwhile, many of the 244 people suffered from side effects ranging from skin rashes to heart palpitations and to liver damage, and yes, even to life-threatening situations. Even with these obviously poor side effects, the panel of 14 author physicians still recommended that everyone with even a slightly high cholesterol go on a statin drug. Not surprisingly, this study was sponsored by AstraZeneca, which is the maker of Crestor, and later examination found that 9 out of the 14 physicians had financial ties to pharmaceutical companies. This confusion over cholesterol, this belief that consuming animal fat causes heart disease, has been propagated. In fact, Michael DeBakey, who's a world-renowned cardiac surgeon and a medical doctor, said in a study that he did, an analysis of cholesterol value in 1,700 patients with atherosclerotic disease reveals that there's no definite correlation between serum cholesterol levels and the nature and the extent of the atherosclerotic disease. The faster that you can drop the connection between cholesterol and heart disease, the more you can start to get superfuel. You know, animals that we eat, they have to eat all day long. They eat grass all day long, or the fish are constantly looking for algae, and they're looking to fulfill their nutritional requirements. And they spend their entire days and their entire lives doing it. As humans, we don't really have time to be bent over eating all the time. This is where eating animals comes in really handy, and especially eating cholesterol and fat. It is supercharged nutritional density. It is jam-packed with energy. And as I said in an earlier video, when you eat cholesterol, a fatty acid, which is a fat, it's up to 80 times more energy than eating the same molecule of sugar. And so as we begin to prepare for a supercharged life, as we begin to hope that we're going to have the energy that we need and the life that we want, it's really hard to get it without cholesterol.